As behavioral health care practitioners, what can we learn from these guys? Well, what we know is that digital natives, people who were raised with computers, many of the people in this room had to learn about computers and kind of evolved with them, but we can remember a time when there was no computers and there were only 3 channels on the television and the television was black and white, and we can remember those days. But the digital natives have never not had these technologies. They raised with it. It's like a toaster to them. I mean, it's always been there. So what they want is their way. This is where they want to access services the way they want to access services. They want to go online. They want to get things online. You're going to hear from Scott about some of the stuff they're doing, very exciting stuff in terms of online tools for people to help them manage their own care. And that's the demographic is wanting that kind of thing. We also know that there's a whole bunch of condition self-management tools out there. How many of you are wearing a Fitbit or a Garmin or something like that on your wrist? I've got a Withings Wi-Fi scale at home that loads my weight into my iPhone automatically. But all of this stuff is the future of information coming in to whatever record, whether it be a personal health record, online tools of any number of kinds. But what it really speaks to is pushing the ability and responsibility for healthcare to the individual, him or herself, as opposed to it being dispensed by a provider. Eric Topol, who wrote the book, the Disruptive Destruction of Medicine, I think it is, something like that. Creative Destruction of Medicine. Great book, talks about a lot of this stuff. When he talks about this stuff, he says, what's going to be the role of a healthcare provider in the future when the client has more data than they do? And it's already starting to happen. I mean, we know people go online to get information. How many of you, before you go to your doctor, go online and research whatever it is you think you got? Yeah, docs love that. Yeah. Well, I think I've got schistosomiasis. No, you've got an infection. So the good news is, and this is what I think what the recovery movement is about, is I want to have a dialogue with my provider. I don't want to be dictated to. I want to have a conversation about my health care. I recognize that this person has knowledge that I do not have. That's why I've engaged them professionally. They're experts in their field. But I also have opinions and thoughts and frankly, and now have access to information. I have asthma, and I monitor every day. I monitor my peak flows. I go into my doctor's office, and I've got a little chart showing, here's my peak flows, here's how many, what I've used, and he's just kind of, holy cow. I said, I take it most people don't do this. I got people who, I say, did you use your inhaler today? Go, I don't know, I think so. I'm not sure, maybe, I don't know. He says, but a lot of people are going and taking more responsibility and using these tools to go in and have these really interesting conversations with their provider. So Eric Topol saying, when that happens, our job will be to help them sort wheat from chaff in terms of the information. We'll help them make better decisions. We'll give them our professional guidance, but the goal will be to help them use that information productively.